Welcome back everyone, Dr. Naveen here from MedCampus. In this short video, we'll quickly discuss topic inherited hyperbilirubinemia. There are four causes for it. One is Dubin-Johnson syndrome, second one is Rotar syndrome. These two, Dubin-Johnson and Rotar, there is elevation of direct fraction of bilirubin, that is conjugated form. So how to remember these two? DR doctor, that means Dubin-Johnson and Rotar, conjugated fraction is elevated. The other two are Crigler-Najjar syndrome and Gilbert syndrome, in which indirect fraction or unconjugated fraction is elevated. Now coming back to the most important fatal form, that is Crigler-Najjar syndrome, it has two types, Crigler-Najjar type 1 and type 2. Type 1 is most severe, presence in children with kernicterus, right? It is very severe because there is complete absence of an enzyme called UDP, glucuronosyl transferase enzyme. It is completely absent. So that's the reason patient do not respond to any enzyme inducers like phenobarbital. You have to go for liver transplantation at the earliest possible. A little milder form is Crigler-Najjar type 2, in which some amount of UDP enzyme is. So if you give enzyme inducers like phenobarbital, the patient will respond. Now the other unconjugated form, the inherited form, is Gilbert syndrome is milder form. Very rarely you will see increased levels of bilirubin more than 3 mg per deciliter, and mostly they are elevated during stressful situations like fasting, illness, etc. So no treatment is required in Gilbert's. Coming back to conjugated forms are two, as I said, Dubin-Johnson and Rotar. So Dubin-Johnson or DJ, you have to remember DJ black. Characteristic feature of Dubin-Johnson syndrome is black liver because of the pigmentation. As I said, it is conjugated bilirubin elevation. It is mainly because of MRP2 mutation, MRP2 gene mutation. This leads to Dubin-Johnson syndrome, black liver. Coming back to Rotar syndrome, the cause is unknown, but in Rotar syndrome, you will not see pigmentation of the liver. Both are conjugated elevation only, but you will not see deposition of black pigment in the liver in Rotar syndrome. So how to differentiate Dubin-Johnson and Rotar? We do very important test known as urine coproporphyrin level. As urine coproporphyrin level 1 is increased, it is more than 80% Dubin-Johnson, it is less than 70% in Rotar. This is how you differentiate these two. And this will conclude our very quick discussion on very high yield topic, that is inherited hyperbilirubinemia.